And we're back with more of The World Tonight. The COVID-19 pandemic is highlighting the need for more social workers. They provide a myriad of services to those in need and vital support to communities during these unprecedented times. BNC correspondent Asher Martinez speaks with several of those frontline workers.
Social workers are constantly providing emotional support and engagement with different types of groups of people in their community. During the pandemic, their workload increased, so did the number of patients and their work hours. And the people that I spoke with tell me that they don't want to quit their jobs. They just want the support that they've provided to this country in recovering from the pandemic.
They come from a background of being incarcerated or institutionalized.
A hard role now made even more difficult.
We try to get the people that we service back on a path to being independent.
During normal circumstances, social work is a stressful profession. Under more trying conditions, social workers face even greater challenges.
I was never virtual. Like, even through the pandemic when everything was closed, I still had to be here. I still had to be here and I still had to be at home with my family.
TYSHA Walker has been a residential program counselor at a residential facility in Philadelphia for the past 9 years. When coronavirus hit, TYSHA had to quietly juggle pandemic pressures, often putting clients ahead of her own family.
A lot of times we were short-staffed. We had staff who actually contracted COVID-19. So we were short-staffed. So on top of 8-hour days, there were 16-hour days.
TYSHA's co-worker of 8 years, RHONDA, was concerned for her health while working at the residential home.
And once I caught COVID and I had to quarantine for 14 days, it sort of made me think. And then I had to change my whole perspective of the way I came in.
When you look at these frontline soldiers, you will most likely see a woman.
So when you look at social work, over 70% of social workers are female.
Melissa Haley is the president of the National Association of Black Social Workers of Southeast Louisiana.
And the services that we provide include services to individuals with intellectual disabilities, those experiencing mental health challenges, homelessness, veterans.
Work that is now deemed essential.
When it came to a point where we couldn't work virtually, I think it was more on the forefront that we're more needed and more valued than what we were previously looked at.
As a result, many single mothers or single women need assistance to continue being workforce leaders in this industry.
I think part of it would be increasing pay, benefits, and making the staffing so that we don't have to do the extra long hours.
Despite the added stressors, it's work neither woman wants to walk away from.
To be there and know that I'm doing a service to someone, it just makes my heart happy.
Yeah, but I love them. And there's nothing that I won't do for them, nothing.
And data found that when the pandemic first hit, a third of social workers wanted to quit their job. The employees were asking for better mental health resources, for better plans when there was a surge in workload, and also for better treatment of their staff. In Philadelphia, I'm Asher Martinez for BNC.